This is very important. Prevention is better than cure. You have heard prevention. What can you do to prevent breast cancer? How can you prevent? What can you do to prevent breast cancers? Breast cancer screening. It is very important. Breast self-examination. You have to teach your your uh, client how to do the breast self-examination, clinical breast examination, uh, ultrasound examination, or you can do the breast examination and you can identify the breast cancers and any other causes in the breast. Mammography, magnetic resonance imaging, MRI, those are the screening tests. Then risk reducing surgery, prophylactic mastectomy reduces risk more than 90% for women high risk of getting breast carcinoma. Salpingo-oophorectomy reduces risk of both ovarian and breast carcinoma in breast cancer mutation gene carriers, hereditary breast and ovarian cancer syndrome. Okay, mammography. This is very important to detect breast cancer at an early stage. Uh, so, screening may be considered in high risk women below the age of 40 years. It is very essential to do mammogram for the you have to detect the high risk women below the age of 40 years and do the mammography. The value of mammographic screening should be explained to those asymptomatic women aged 40 to 49 years who have expressed their wish to be screened. The patients or clients should be wish for mammography screening. Then in patients on postmenopausal hormonal replacement therapy, a screening mammogram should be performed before therapy is started to establish a baseline, as well as to ascertain the absence of any malignancy or other lesions. Annual or benign screening if the patient has been on human replacement therapy for more than 5 years. High resolution ultrasound is the first diagnostic imaging method in women less than 35 years of symptomatic women. In a screening mammography, ultrasound is useful adjunct and is recommended in the assessment of a patient with dense parenchymal pattern on mammograms. It is most useful in differentiating cyst from solid masses. It is very essential to identify that it is a cyst or solid mass, or it is a benign one or malignant one, thereby avoiding unnecessary biopsies. Biopsy is taking to exclude whether it is cancer or benign cells. Mammography. You can see in this picture how can they do the mammography. Screening. Breast self-examination, opportunity for women to become familiar with their breast, monthly exam of the breast and underarm area, may recover any change early, begin at age 20, continue monthly. It is very essential to make aware the clients to do the breast self-examination in every month. Men to do breast self-examination. Menstruating women 5 to 7 days after the beginning of their period. Menopausal women same date each month. Pregnant women same date each month. Takes about 10 minutes. How long it should take? 10 minutes. Perform breast self-examination at least once a month. Examine all breast tissues is very essential. Okay, in these pictures you can identify, you can understand how to do the self breast examination. Well, examine your breast self examination. First one, stand in front of a mirror with your arms relaxed at your sides. look for change in the breast, and then grab hands behind your head, press hands forward and look for any change in the shape of contour of the breast. Then continue checking as you press your hands. Likewise, then gently squeeze each nipple and look for discharge. Then raise one arm using one or more of the methods below. Press firmly with your fingers and not the tip of the fingers. Use the thumb of the fingers and a pad of the finger. Peel around the entire breast area for lumps or thickening. Likewise, then repeat this step in the shower. It's often easier to find lumps when your skin is slick and soapy. Then seventh step, repeat this step while lying on your back. Put the hand of the side you want to examine. Then choose the method, lines methods or circle methods, clockwise method, then wedge method. You can use any method and you can do the self breast examination by yourself. It is very essential to do this. Screening for general population. Recommendations. Mammography may be performed benignly in women from 50 to 74 years of age. Grade A. Breast cancer screening using mammography in low and intermediate breast women age 40 to 49 years old should not be offered routinely. Then women aged 40 to 49 years should not be denied mammography screening if they desire to do so. Breast self-examination is recommended for raising awareness among women at risk rather than as a screening method. Okay. Then recommendations: screening women at high risk for breast cancer should be done from the age of 30 years with both MRI and mammography, as it is more effective than mammography alone. MRI screening should not be performed in patients with lobular carcinoma in situ and atypical hyperplasia. Okay. Then let us see diagnostic procedures. Fine needle aspiration cytology, core needle biopsy, true cut biopsy, other tests, progesterone receptor, estrogen receptor, human epidermal growth factor receptors. Okay. Then TNM staging. Already I have talked with you TNM staging. Okay. Earlier I have talked about investigation. Let us memorize again. Mammography, most accurate method to detect non-palpable lesion, cancer change including microcalcification to visible lesion, biopsy or aspiration, conclusive for cancer diagnosis and to determine type of breast cancer, estrogen and progesterone. Those are receptor status, proliferations, phase study, and other tests of tumor cells used to determine appropriate treatment and prognosis. Laboratory tests to detect metastasis. Increased values on liver function test indicate possible liver metastasis. You have to identify if it has spread to the liver, so you have to do liver metastasis test. Increased calcium and alkaline phosphatase levels indicate possibly bony metastasis. Additional metastasis workup includes chest X-ray, bone scan, possible brain and chest CT also may useful. Okay, TNM staging. Hereafter we will talk about what is TNM classification, and earlier also I have mentioned that also. Thank you very much for listening.